Hey everyone, hope you're doing well. Just one last Ed puzzle for the end of our class. I honestly just can't believe that we have reached the end of this term and of the fall term overall, since this is the second half for us. So hopefully you're feeling positive about it. I'm sure that you are. I know that students that are in the program here at RMU get a couple weeks off, which is phenomenal. Our online students don't get any time off except for a day here or there until this break. So everyone appreciates it. You all, faculty, staff, we all like this little break that we have here coming up. So just a couple things from last week. In our discussion, I think everyone had pulled some really interesting, and I unfortunately didn't get to see them all last week, but I'll see them as I'm doing the grading. The articles that you pulled regarding cost benefit, cost effectiveness analyses, some really interesting ways that we can impact cost effectiveness, and keeping in mind as we talk about it. Cost effectiveness, sometimes things that are cost effective are not necessarily the choice that we may make for ourselves. I'm probably going to, well, example, I ran to the store this morning. Tomorrow's our cookie exchange at RMU, and I had to get some stuff to make some cookies tonight. So ran to the store, and I could buy the flour that's the brand, generic brand or whatever, store brand. It was $1.25, or I could buy King Arthur flour, which is known as being pretty good for baking, and I think that cost me $3.99. Is that a cost-effective purchase? Absolutely not. But I chose, it's my choice, and I think sometimes that's where cost effectiveness and healthcare kind of they clash a little bit. Another, kind of a healthcare example, my dad had this notion in his head. He passed away a few years back, 4.5 years ago or so. But he had this notion in his head throughout his whole life that he had to have the physician write dispense as written at the bottom of any prescription because he didn't think the generic drug was good enough. I think it took probably 5 or 6 years of me, trying to explain once myself got into the healthcare field. You personally are paying so much more for this drug, and your insurer is paying so much more for this drug, and it's very likely that that generic is going to work for you in exactly the same way. So why don't you give the generic a try? And that is the cost-effective notion. But sometimes we as patients don't want the most cost-effective. We want what we think is going to work for us, and there's a certain placebo effect in some cases. If we don't think that's going to work, it's not going to work. Physical therapy is a good example of a lot of people, if they have some kind of an injury and they think they need surgery, and surgery would be the next step, but the physician always says, "Oh, try therapy first." Well, sometimes therapy just doesn't work for them because they don't believe it's going to. They don't put the work in that they need to. So it's an interesting cost effectiveness, really great. As health organizations, health plans, healthcare organizations, we're looking to have the most cost effective. We're looking to provide the patient the best value. But sometimes even what's most cost effective is not what the patient wants, and we need to keep that in mind. One other thing about the discussion, if you have a situation, obviously it's not really going to be impacted for us in this class moving forward, but just in general, a good thing to do if you have, and I had asked for a couple of them in the discussion boards. You had posted information about an article, but I was unable to access the full article. So I know a lot of you have access to resources outside of RMU. You may work for a place like UPMC. You may actually have access to a library from your undergrad. We have a couple students from another school, so obviously you have access to your library. If you could what would really be helpful, especially if it's not something that's readily available in the RMU library or on Google, in Google Scholar or on Google, if you could attach a copy of the article, that would be really helpful, because I found that all I was accessing was the abstract, and I couldn't get my hands on readily. Through RMU resources, I couldn't get my hands on that article. So if you find that you have access to the article through some other mechanism, if you could just attach that to your post, that would be really helpful. On the flip side, if all you can see is the abstract, that's probably not the best. Sometimes the abstract is not the best way to to access an article, it'll give you an idea and it'll tell you that you want to see the rest of it. If all you can access is the abstract, I have two recommendations. Number one, move on to a different article if you can find another one that it meets your needs. If you really want that particular article, it's really interesting, something that really meets the needs of what you're looking at, reach out to me or reach out to your professor for that course. A lot of us have access to resources elsewhere. For example, I know that RMU's library has gone through some changes recently, and we don't have access to quite as many journals as we used to, but I personally have access to the library at Syracuse University, at Creighton University, at Northeastern University. My husband has access to the libraries at St. Louis University, Duquesne, where he works, and University of Central Florida. So pretty vast, couple of med schools in there. So usually we can find articles in the medical space and the healthcare space if you're looking for them. So if it's something you really want that one, feel free to reach out and I'm happy to try and find it for you. If it's something that, for a discussion board that tends to be a fairly quick turnaround, you find something you want it that day or the next day. If you have a longer time, so like for example, if you were looking up something for your project, and you know that you have a couple weeks before you need it, you can always request articles through the RMU library. They can get you, as long as it's something that they can get from another library, they can usually get it for you very quickly, but not within a day. I mean, it's usually a few days, sometimes a week if they really have to reach out to get it. But they can certainly still get you articles. But key point is, I wouldn't suggest doing a discussion, and certainly not a paper based on abstracts, because the abstract, I know I review enough journal articles as an editor, editorial reviewer. A lot of times the abstract is misleading, and depending on the depth of the editorial review, it may not get fixed before it gets published. So sometimes that abstract can be a little misleading, and you need the full article to get additional info. Looking forward to seeing everyone's papers. I have not taken a look at them yet, but certainly looking forward to going through those this week and seeing what everyone came up with as some new, more comprehensive care coordination, better ways to reach the triple aim throughout your ideas that you had to move forward in your chosen type of organization, or your organization if you chose to go that route. So week 8. This week is short. I think I put it in the announcement, and I always try and remind everyone. Weekends on Friday, so please be sure to get. All we have this week are discussions, but please be sure to get your final posts up by Friday. It'll be the same requirements Wednesday, Friday instead of Wednesday, Sunday, but it'll be the same requirements for this week. But this week we're talking about trends. So we're talking about trends in population health and the notion of improving the health of the population moving forward. There is an article in here. It's a little bit old. I'm actually going to put this other article into the classroom as well. And please feel free to use this one and the Gruel article for your discussion this week. So this is kind of interesting. This itself is a little old from the realm of population health, because it's from the beginning of this year. And this is such an evolving thing. It's really moving so quickly. But a couple things that I'll point out in here I thought were really interesting. Apparently this page thinks that I need Xeljanz too. So here's I have celiac. I have a bunch of horrible things, but I research that stuff pretty regularly. And Xeljanz is for ulcerative colitis. So it's always interesting when I go to these medical pages what they're going to bring up to show to the world as I look at them. So what was interesting about this particular article is that they really focused on how the future of population health, the future of this realm, is focusing on the consumer where they are. And I think that this is really, it's not limited to healthcare. I know that's something we're trying to do as a university, especially in our online programs, really meeting the student where they are. I'd be willing to bet that if you talk to folks in the retail industry, be it clothing, food, consumer goods, whatever it might be, they are the same thing, trying to meet the people where they are. Cyber Monday is probably a bigger shopping day. And I don't know, this is just totally, off the top of my head, but I would be willing to bet that there are more people shopping on Cyber Monday than on Black Friday now, because so few people actually go out to the store to shop. So really trying to meet us where we are. I want to do my Christmas shopping sitting here at my desk where I'm comfortable. I don't want to fight crowds, but I want the same price as if I had fought crowds. So it's really about meeting people where they are. A couple ways that we're doing that in the healthcare industry, and I just wanted to mention these two, but there are other great ideas in this article. Precision medicine. So looking at precision medicine, how we're taking not just, this patient's coming in with high blood pressure. I'm going to maybe watch them for a couple months, monitor their blood pressure, and then next month I'll give them, lisinopril, whatever it is that is my normal first line med. I'm not going to do that anymore. I'm going to look at this patient. I'm going to look at the research for patients that are like them, maybe female, maybe different races, different ethnicities, different exposures at work, different, weight being different, activity level being different. I'm going to look at all of those things. I'm not just going to say, okay, you're here for blood pressure. I monitor you for 3 months and then I put you on lisinopril. I'm going to customize. I'm going to make my medicine precision for you. And that's really where we're moving. And this precision medicine movement is really, as this says here, really linked to population health. How do we grow the health of our population overall? By providing care that is the best for them. And I think somebody had posted an article. I know I was reading an article last week, so I think it was posted in our discussion board about, I think it was high blood pressure and heart disease for African Americans, and how the response to medication and in different treatments is different based on their genetic makeup, their background, their race, their ethnicity, all of that. So I think it's really important that physicians really start to look at that. I mean, that to me, it's a no-brainer. But a lot of times, and I think any of our clinical folks in the room, I used to work in emergency medical services. My husband, that was his career. I used to do that, as a volunteer. But sometimes you get tunnel vision, like, oh, okay, I'm responding to a scene, and I know that this patient has abdominal pain. Well, abdominal pain can be a lot of things, but sometimes paramedics, EMTs get tunnel vision and they're like, oh, it's got to be this, it's got to be this. And we see the same thing in physicians and in other providers. They get that tunnel vision. Oh, blood pressure is slightly elevated. Oh, let's watch them for 3 months and then give them this med. And maybe in that 3-month time frame, that patient suffers a hypertensive crisis and ends up in the emergency room. So we need to change the way we're treating patients. We need to meet the patient where they are, be it in our office, or it could be in our home. And I think that that's another element that will move forward with the precision medicine movement. Precision medicine is a lot more than just looking at a patient's race, ethnicity, gender, lifestyle choices. Are they active? Are they not active? Etc. It's a lot more than that. But I think that is a good first step. And then we, kind of draw in the provider community into looking at these greater evidence-based techniques to providing really good care to that particular patient. So just exciting things for the future. The other thing I wanted to mention are these deals, this continued deal making as it talks about in here. All of these companies that are not really alike are joining together. And so we're not talking about a large hospital system just buying up more hospitals, although I think that will be impactful as well. But we're talking about unlike companies coming together to work in the healthcare space. So the one that I like to talk about the most is the Amazon venture. So it's Amazon, Berkshire Hathaway, and JP Morgan Chase. So Berkshire Hathaway and Chase, that's the money, obviously. Amazon is looking to spearhead this, and they actually hired Atul Gawande, who Dr. Gawande, I'm sure you have probably either read his work just for pleasure because he has a lot of really great books about the healthcare system, but or read his work in a class. In our classes, I guarantee that you've read at least one Atul Gawande article, and he's brilliant and is really focused on disrupting our current healthcare system because that's the way it's going to be fixed. And a lot of times when we say disruption, people think about it negatively, but this is positive disruption, making a major change in the way we do things to make change for the future. And so these companies, like this Amazon venture, it's called Haven, but this venture is really going to disrupt the way we provide healthcare. They are truly going to look to meet the patient where they are, likely right in their home. So really interesting things and that are truly going to impact the health of our population overall. So I think that's about it. So we have our one discussion, but we also have a second discussion. I don't think I mentioned this, but we have this second discussion this week. It is optional. You do not have to participate. And what we're looking for in that discussion, or what I'm looking for personally, is your feedback. So you will also receive a separate survey, confidential survey. I won't see, I only get the aggregate results. I do get the information, but that's used by the higher ups at RMU to make choices based on the way students provide feedback, to make choices on course assignment and whatnot in the future, and also to put into kind of our personnel file. That is the academic version of a review, a performance review. You guys get to do our performance reviews. This is completely different. And then this is used for is truly for me to improve the course and to improve the way I'm doing things. So we take, feel free to be open and honest and share things you liked, things you didn't like, other things that you would like to see in the class, especially being this class is population health and care coordination. We can really focus on one or the other. They really are linked, but I'm always looking for ways to improve this class, additional content you'd like to see, those types of things. So every term we get feedback, and every term I make changes to the class. So we are truly using this, but also please complete that other survey. That's really helpful for planning purposes for Dr. Wentling and Dr. Hampy, who are the department chair and the program director, and helpful for me too overall to see if people are sharing information, good, bad, or indifferent about the way I teach a class and the methods and whatnot. So both are very, very helpful and very important. So if you could take the time to do both, that would be fabulous. And I think that's about it. Class ends on Friday this week, Monday to Friday for this final week. Discussions need to be in by Friday night. I think I already mentioned that. And I think that's about it. So hopefully you enjoyed the class. I've truly enjoyed working with this group. I think this is the last time I get to work with, no, maybe I get you, I might get you next term too. No, I don't think I do. No, in the summer, I'll get to see you. So for the students that are in this cohort, I think you will be stuck with me one more time. For the students that are not, that are from other universities or other programs, please feel free to come back to RMU at any time for other coursework you might need, or reach out to me if you need any help with anything. I'm always happy to help a former student in a class, or if you're just looking to bounce an idea off someone, etc. So I wish you all the happiest holiday season. I hope that you have a great couple weeks off if you're an RMU student. I know that'll be a nice rest for you all, and please feel free to reach out in the future. Look forward to talking with everyone in the discussion this week. Thanks.